Diagnosis of vasculitis is a very, very difficult. You have to take what the patient is saying and match it up with the correct symptoms and match it up with what is happening on their body. There are lab tests for vasculitis, but they're not very specific. They're not unique to this disease. There can be a lot of mimickers of it. Sometimes scans are needed, like chest x-rays or CAT scans, etc. Sometimes a biopsy is needed where a sample of a blood vessel is taken and then you can look at it underneath the microscope and you can see the inflammation taking place. But most importantly, it's just ruling out other diseases because remember, vasculitis is a very, very rare. So other things that can give patients these same symptoms like thyroid disease or infections or cancers, medications, etc. When it comes to the treatment of vasculitis, is just like the treatment of any other autoimmune rheumatological disease for the most part, where you push down the immune system and the disease does go away. However, you always put the patient at risk for infection or cancer, so you have to be sure about the diagnosis. And in these patients, what seems to be unique is now these blood vessels that used to be nice and straight are now kind of rough on the inside, so they are at more risk for heart attacks and strokes, so they may need an aspirin to keep the blood a little bit slippery.